tonight, are overstretched GPs missing the symptoms of heart failure? That's what researchers think.
And their findings have been backed by a woman whose life was saved by heart surgery.
We need more GPs, and for me personally, I don't think the 10 minutes to see a GP is long enough. Not at all. To get out or what's wrong with you, to discuss with your doctor, it's just not long enough.
That was Rosie O'Donnell. Well, experts at the University of Leicester believe more lives could be saved with better diagnostic equipment and, crucially, increased awareness.
Not in hospitals, but out in the community. More on this now from our health correspondent, Rob Sissons.
Sophie was diagnosed with heart problems in hospital. She wishes more could be done in GP surgeries to identify problems earlier.
What happened to me personally, I don't blame anybody. It's just one of those things. I knew something wasn't right with me, and but I always feel like I'm rushed. And so it would be nice to have more time so you can describe all your symptoms to your GP, and then hopefully get to the bottom of the actual issue rather than ending up in hospital.
The study analysed patient data over 20 years from across England. At the end of the period, 7 out of 10 patients were diagnosed in hospital with heart failure, compared to 1 in 4 at the start. Analysing the findings, researchers from the Leicester Diabetes Centre say it's clear it's a complex picture.
I think there's a combination of reasons. So one is that patients have got more diseases, more conditions, so symptom recognition is more complex. Other patients will present to GPs, but symptoms for heart failure are not specific. So once patients have got a number of conditions, it's very difficult to actually pinpoint which condition those symptoms belong to.
That said, on the front line, Dr Kadam, who's been a GP for 25 years and behind the research, says it's clear much more can be done.
The main challenges of GP general practice are twofold. It's having sufficient GPs to see these complex patients, and the second thing is having the time.
Hitash in Leicester now knows patients have a responsibility for their own health too. He only went to hospital after he'd collapsed 6 times over a month out jogging. He needed emergency heart surgery.
One of my valves, which is the aorta valve, was going so close to closing, which sends the oxygen into my brain, and that was the cause of the dizziness and collapse. Don't ever do what I've done. I'm a very lucky man.
Heart failure remains a big killer. Doing more about it, a priority for the NHS.
Well, that's the key, isn't it? So let's speak to Rob now, who's in Leicester. So lots more can be done to save lives.
That's exactly right, Sarah. I mean, in inner city deprived areas, cardiovascular disease is the single biggest cause of premature death. There's so much more can be done. Let's not take away, though, from the fantastic work the NHS does, saving lives every day in this field, of course.
So far as this new research is concerned, what have NHS England had to say?
Well, they stress they are determined to do more about it, save more lives, and it's a central part of the NHS long-term plan that's going to be implemented over the next 10 years.
All right, Rob Sissons, thank you.